It's really an honor for me to be here today on such a distinguished panel with the Secretary and Jenny Kenny, who's one of my personal heroes, and I always love hearing her data dump. So that's a treat for me, and I didn't actually put as much data as I normally would in my presentation since I knew Jenny would be covering that. But it's really a great opportunity to kind of step back and reflect on where are we with respect to covering kids today and think about the years ahead. And I think it's not an exaggeration to say we are really at a defining moment right now with respect to health policy, and particularly with respect to coverage for kids. So before I get into my presentation, let me just take a minute to explain who we are. The Georgetown University Center for Children and Families, we've been around for about 6 years. Many of us have been working on these issues for much longer, but we are really a nonpartisan kind of policy think tank. But we're we're mission-oriented. Our goal is to get all kids and their parents covered, and we like to roll up our sleeves and get involved with state and federal policy directly and not be much in the ivory tower. So I encourage you to check out our blog. It's called Say Ah. And it's funny, when our communications director first suggested a blog, I, being the Luddite that I am, did not even know what she was talking about. But I've come to really love the blog, and it's a great place for folks we have a lot of guest bloggers. In fact, we've got Jill Henkin who's doing a blog for us right now. But we share a lot of interesting state activities that's going on, particularly in the area of outreach and enrollment for kids. We also are the National Backup Center now for the Covering Kids and Families Project for Robert Wood Johnson, and a bunch of other foundation initiatives. So we really view it as a forum for you all to participate and share some of your best practices and other policy ideas. So I encourage you to check that out. Okay, so let's move ahead. I always think it's absolutely critically important to start out by recognizing that when we're talking about coverage for kids, it is one of the few bright spots in our country right now. We have made enormous progress. If you look at the uninsured rates, despite the fact that overall the uninsured rate's going up, it's going up significantly for adults. Obviously, the economic conditions are contributing to that, but it's actually going down for kids. And we've really had enormous success through Medicaid and CHIP in reducing the number of uninsured children. And I think it's important, and Virginia is no exception. I know Jenny's going to have a lot more detailed data on this. But you've been making progress, and it's really a wonderful thing when children's poverty numbers are going up quite dramatically, that their uninsured numbers are going down, and it's about 8% nationally. So that's just a huge accomplishment, and it shows that when we really set our mind to something and folks work together, we can get it done. So of course, right now, as many of you know, the Affordable Care Act has a provision called the Maintenance of Effort provision, pretty pithy. And that does currently, and actually through 2019 for kids, require that states do not lower their eligibility level for kids, nor can they put up any more barriers to enrollment. So the Affordable Care Act is helping to secure that progress that states have made really on their own within the federal context, but taking the options available to them. But even despite that, states are still, despite the bad economic climate, all of the challenges, states are still moving forward. And so we do a national survey every year with the Kaiser Commission on Medicaid. And there are many states that have expanded eligibility, that have continued to reduce red tape barriers. And I know your secretary is very interested in reducing red tape. And that's been, I think, a real focus and a real success across the country. So here you can see the uninsured rate for kids. And for those of you who've been around for a while, you probably remember when the CHIP law was first passed in 1997. And that's just to the left here. This chart starts in 1999. But at the time that CHIP passed, and this is still true today, most kids are actually eligible for Medicaid. That's where the bulk of the kids are. But the CHIP program not only expanded eligibility up the income scale, it also brought a renewed focus and attention on simplifying procedures and doing outreach to families so that they knew their kids had an option. So you see a really sharp decline in the number of uninsured kids since CHIP passed, and those are kids both coming into CHIP and Medicaid. A little bit of a spike up, but again, we've been with the renewed attention and the CHIP Reauthorization Act, we've continued to see wonderful progress, and really we've had the lowest uninsured rate since we started collecting data a couple of years ago. So that was phenomenal. So let's talk a little bit about the landscape we're in right now. Lots going on in the world of health policy. Never a dull moment. And we're going to talk some more about health reform implementation, both the politics and the substance, in a minute. But that's obviously a huge backdrop to everything that's going on. State budget situations, you all know better than I do that states are facing challenges, and Medicaid enrollment has been going up because of the economic conditions at a time when state revenues have really been falling. And because state revenues have fallen so precipitously, that gap and the ability to maintain, particularly the Medicaid program, has been tough. And when you look at Medicaid, actually the enrollment has been going up, but the per person costs in most places have not been going up. So there's been an enormous amount of cost containment in the Medicaid program, but you're seeing your budget go up because you have more people on, really because of the economic conditions. So these kinds of tensions, I think, have led to an enormous amount of discussion about the role of the Medicaid program between the state budget pressures, its role in the Affordable Care Act, the Medicaid expansion, which we'll talk about, the deficit reduction process at the federal level, the super committee, a lot of debate swirling around. And of course, as you know, at this point in time, it looks like the super committee is on track to be dysfunctional, as one might have anticipated, but there's always a chance they won't be. But there certainly is a lot of discussion about Medicaid cuts, and any federal cuts, of course, really are ultimately a cost shift to the states, particularly some of the specific proposals they're looking at, and that's very concerning when you're already facing a lot of challenges at the state budget level. So again, as we think about our sort of mission to get to the day when all kids have coverage, I think this slide is just absolutely critically important. And it's just amazing that about 2/3 of kids who are uninsured today are already eligible for CHIP and Medicaid. And Jenny's going to give you a lot more details and nuances about this population. But to me, the bottom line about this slide is that there's so much we can be doing today. You know, regardless of what happens to the Affordable Care Act, we can still make progress for kids, and we can do it now. We don't have to wait till 2014. There's a lot that we can do to simplify enrollment and retain those kids once they're on the program, which is a critical issue. It's just, I think, is a reminder to us all of how important the work you do is every day and how much we can make progress in this issue. So we're going to tag team a little bit, I think, Jenny and I, on the structure of health reform and what it means. But the reason I like this slide, and I came up with this last year, is because one of the interesting questions, and we're not going to actually spend a lot of time on this today, but when you think about the world after the Affordable Care Act largely kicks in 2014, you've got kind of three legs of the stool, which is not dissimilar to what you have today, but you have the employer system, you have the Medicaid program, which will be expanded to essentially 138% of the poverty line, and parents and childless adults will be covered. So that will promote an enormous amount of simplification in some respects, because you'll have just a straight eligibility line. And for kids, the fact that their parents will be covered is a huge step forward. We know that when parents are covered, kids tend to enroll at higher rates, and that kids who have healthier parents do better. It's just good for kids to have their parents enrolled. So that's going to be very important. And then on top of Medicaid, in the new exchanges that states are developing, you will have federal tax credits that provide premium subsidies for those eligible in between the Medicaid level and 400% of poverty. So those will kind of be the legs of the stool. Most people will fall into one of those circles. There still will be some uninsured people. Some of those folks will be immigrants who aren't eligible. Some of them will be people who are eligible for Medicaid, but they're not enrolled, like that slide we just saw about the kids. But some of the interesting questions, I think, arise about really where the circles overlap, and some of the intersections between the exchange and Medicaid will be very important from the perspective of enrollment eligibility, because a lot of people are going to be coming in through the same door. So we're going to have to make sure that these pieces really work together. So just one thing to clarify, though, because there's, I think, a lot of confusion about this. The federal law is very clear that if you're eligible for Medicaid, you are not eligible for the premium tax credits in the exchange. So that's just an important note to mention because there's been some confusion about that. Okay. So this slide shows really what's going to happen according to the Congressional Budget Office, which is in Washington, who we all have to listen to, with respect to the number of uninsured after 2014 when the main provisions kick in. So you'll see a very dramatic decline in the number of uninsured. We're not going to get to universal coverage. We're going to get to about 94% in CBO's estimation. But I think the one thing I just wanted to highlight about this is that I think this is, assuming that the ACA goes into place, and we'll talk about that in a minute, this is going to be a big cultural change, which is we're going to live in a country at that point where there's a presumption that you have health insurance, and that's not really the case today. And so that is going to be a kind of cultural change that I think will affect the work that all of you do and the way that we think about approaching these issues. Because if the default is, well, I'm going to be eligible for something, that's a very different mindset from today when, particularly when you're dealing with low-income families, you know, the parents probably aren't eligible. They may not be sure about their kids. So this is going to be a big, big culture change. So this just shows of the newly covered folks really where they're going to go. And the biggest group will be going into the exchange with those premium tax credits I mentioned. The second largest group will be going into Medicaid and CHIP. So that will be pretty a lot of change coming your way. Okay, so this is, I think, a question that's always on everybody's mind, and particularly for those of you on the ground who are working on this, and a lot of question marks swirling around in the air, and it makes it difficult, frankly. I mean, it's a tough political climate, and it's sometimes hard to know what to do. And so I am obviously no crystal ball here. So, but I stole a slide because I'm not a lawyer and I'm certainly not an expert on the Supreme Court, but I stole this slide actually from Chris Jennings, who is a longtime healthcare policy kind of consultant in DC and very widely respected. So with respect to what is the Supreme Court going to do? As he laid out here, there's three possibilities: that they uphold the law basically as it is, that they overturn the individual mandate requirement, which is what is attached to those folks. It's attached to folks above the Medicaid level who will be going to the exchange and everybody else. So they might overturn the individual mandate requirement. That's really where a lot of the discussion is with respect to the lawsuits. But they'll leave probably everything else in place. The third scenario, they kind of throw out most of the law. So it seems, who knows what they're going to do, but probably they're going to do one or two is what most people think. So the reason I wanted to bring that up is because if they just end up doing one or two, the Medicaid expansion will remain in place. And so many of the issues we'll be talking about today will really be unaffected by the Supreme Court's ruling. And it's important to keep that in mind, that there is that distinction on the Medicaid and CHIP side as opposed to the rest of the bill. Okay, so then of course the other huge question for what's going to happen with health reform is, you know, who's going to win the 2012 election, given that I think virtually all of the Republican nominees have said they want to repeal the bill. So that's obviously a huge question that nobody can answer. But I don't spend a lot of time thinking about this because I think it's not very productive at the moment. But in any event, I have crossed my mind now that it seems likely that Governor Romney will be the nominee, that what would he do? It's just an interesting question since he was in Massachusetts when they did their universal coverage bill. And so it seems to me that he will preserve in some way some amount of state flexibility. I would imagine that he'd be personally very committed to that, to allow states to get waivers or move forward on certain things What will happen to the money that's attached to the law? I don't know. But one thing which I think is important in relating to the issues we're talking about here today is that the move that your secretary is committed to, and many others as well, to moving to a more streamlined process, to moving to online applications, online verification, all of those, that is coming, and I don't think that is going to change, even if the Affordable Care Act is repealed or struck down, whatever it is. That's just the way of the 21st century. And so moving ahead with a lot of these initiatives and thinking about simplifying and reducing red tape because it reduces administrative costs, because it just makes sense, because technology is our future, I think all of those issues will still be here to stay. So despite the big picture political certainty, really what I wanted to highlight is that many of the issues we're talking about today, I think we're going to go forward in one way or the other, and that is what makes it so important to keep doing the work that you all are doing. Okay, so let's get to a little bit more to the nitty-gritty now. I'm now going to talk to you about some of the federal regulations that have been proposed in implementing the Affordable Care Act. I actually brought them with me, but I think I left them down there. There has been a lot of paper that has come out recently, and many of us have been engaged in doing comments on these over the last 2 or 3 months. And it's pretty in the weeds, and I have to tell you, I've not committed them to memory yet. So I don't want to get too in the weeds for you all. But in general, I think what CMS, the federal agency that is issuing these regulations, is trying to do really is to build on some of the successes that we've had in kids coverage and bring some of those lessons to bear as we think about the Medicaid expansion going ahead and bringing up these new exchanges as well. So there's sort of certain principles they're trying to follow. They'd like it to be consumer friendly, technology enabled. Technology has been a critical piece of what's come out so far, both in terms of funding and some of the guidance, simplified process and a coordinated process. Okay, so the regulations that we've seen so far, and we'll see more, have focused quite a bit on the new exchanges, and we're not going to talk so much about that here today, but both their governance and what kind of consumer assistance will be available, the qualified health plans, which will be participating in those exchanges, but a lot about enrollment and eligibility in both the Medicaid and the exchange system. And since those two pieces will be working together, that's very important to understand. Also, we've seen some proposed guidance on the tax credits that will accompany, that will be the subsidies for the exchanges. So let's talk about the parts of the regulations that I think would be of most interest to you, some of which are reflecting statutory changes in the Affordable Care Act and some of which are fleshing out some of the Affordable Care Act. So here's probably the single most important changes. I know a lot of you work in eligibility and enrollment. But the bill itself, the Affordable Care Act, says that we will move to what we call MAGI, Modified Adjusted Gross Income. And what we now know from seeing the regulations is that all of the categories, all of the current categories of Medicaid that are based on income or pregnancy will be collapsed into 3 groups. You'll just have children, pregnant women, and parents and caretaker relatives. So those categories that relate to SSI, disability categories, will stay the same. We're really talking about the folks who are in Medicaid largely because of their income, not because of their disability status. That's the way I think about it. So a lot of categories will get combined and reduced, and you'll have those 3 categories. There's going to be a new group. There's the new adult group I talked about earlier with the expansion to 133. That will be significant. And there's also a new category if states want to continue doing an expansion that's kind of a broad catch-all category if they want to continue going up the income scale. So what are some of the rules and the ways they're going to be changing? Very few states have an asset test left for kids, but no asset test will be permitted, so that will be gone. Face-to-face interviews will not be allowed. And there are a lot of new rules, very complicated rules that I have to admit I don't fully understand. but related to both income and family size. And the idea is really to try to coordinate better with the exchange and the tax code, because the tax credits are going to be this vehicle, and because so many people will be coming in through the same door and going through that eligibility process with the exchange, to promote simplicity, to promote coordination, there's an effort to align those rules wherever possible. They're not perfectly aligned, though, and that's why it's so complicated. There are some exceptions that CMS has made in the case of Medicaid, but in general, the idea is to align those income determinations. So we will no longer have income disregards or deductions. I think I mentioned this earlier, that there'll just be a flat 5% disregard above 133% of poverty. Okay, so people are always, it's one of those things like if you say Magi and your family thinks you're a freak or something, because what are you talking about? So I think a lot of people were thinking, oh, CMS, you're just going to tell us a number. You know, you're going to help us convert our disregards, and you're going to give us a formula, and you're just going to tell us our income eligibility level. Unfortunately, it's not that simple, because it's a methodology. It's how you look at the income, what you count, who's counting in the family, whose income has to count in the family, and that's where this new coordination with the tax law comes in. So unfortunately, it's not quite as simple as just going to 138 and calling it a day. So this, hopefully you guys have the slides as handouts, because it's kind of complex, and I didn't want to go through all of the changes here, but you can see that in general, we're moving to a tax filer as the household and all the tax dependents. And there still are some changes from the world of Medicaid that will remain, that are being brought into this, like pregnant women being counted as two, which is not the way it works in tax land. But I'm not going to go through all of these. We can talk about them in the Q&A. But in general, we will be moving to a new way of counting income and thinking about households. So we talked earlier about the fact that states, there's actually different rules for kids and for parents and adults in a couple of different ways. Right now, I mentioned the maintenance of effort, that for kids actually is in place till 2019, that a state has to retain its effective income eligibility level. For adults, there is currently maintenance of effort, but that's going away as of 2014 when the statute is fully implemented. So kids are a little bit in a different status. Now, let me just take a second here to mention the issue of CHIP and the future of CHIP. The CHIP program is currently reauthorized through 2015, well, funded, I should say, through 2015. So it's got 2 years of funding following the startup of the Affordable Care Act. So what's going to happen to CHIP? Nobody really knows, and it's a really big question. Right now, we have this maintenance of effort that's in place till 2019, where states have to preserve their Medicaid and their CHIP levels. But obviously, a lot of the CHIP kids would be going into the exchange if there wasn't CHIP. And it's just a big question mark, I think, what's going to happen to CHIP. But of course, it's one big question mark among many. So we'll have to see where things go. But in any event, children do have this longer maintenance of effort than adults. And then another requirement, and this is a statutory requirement in the law, is that parents cannot enroll in Medicaid unless their child has coverage. So that's sort of like the twist on the individual mandate for the Medicaid population. Okay, so one of the essential principles of the Affordable Care Act is really that there's going to be no wrong door. And you know, you all have probably heard this analogy before, and it was certainly discussed on the Hill as the legislation was being drafted, that you know, everybody wants a Travelocity kind of website where you just come in and you know, you plug in your this and your that, your family members and your income, and then the computer is going to magically tell you what you're eligible for and how you can get it. So obviously, life is not that simple, as you all know. But I think there's a really strong emphasis, and this is where when I talk about the exchange and Medicaid, that there's not going to be any wrong door for people applying to Medicaid. So if they come in through the exchange, they have to be routed to the Medicaid program if that's what they're eligible for. But there also has to be an ability to apply over the phone, by mail, in person. And we know for some folks who have, for whatever reasons, may not have access to the technology, may have difficulties using the technology, may require to submit certain kinds of documentation to prove things, that you know, it's not just going to work that simply, that everybody can just punch it into the computer. So there's an emphasis on having some assistance, navigators they're called, to help folks. But this is a lot of what you all do, and preserving these other avenues are important, particularly for harder to reach populations. Once the information comes in, there's also a really strong emphasis on the regulations on verifying whatever you can through electronic sources, so that you don't have to go back to the family and ask them for more paper, and you all know that this can be a barrier to coverage. But there will be a federal data hub that states can access to try to verify things like citizenship, and I'm going to have another slide on this in a minute. But again, a real emphasis on using technology to do verification rather than having to go back and swap paper documents. And then the goal is to have a real-time determination, or a smallest amount of time that goes in between you file your application and you're determined eligible. And this, I think, also reflects that we will be in a different culture of coverage where everybody's eligible for something. And so we have to just quickly figure out what that is, and hopefully technology will help us do that. But you know, since it's a lot more complicated today as to whether particularly the adults are eligible for anything, that will change, since by and large they will be eligible for something. Okay, so the application process, there is quite a bit in the regulations about trying to ensure that questions that aren't really needed for determining eligibility are not asked, so that the process is really simplified. And so one example of that is that you can't require a Social Security number for non-applicants. This actually has been guidance for a while, but now it's in the regulations. It's a little bit different for the tax credits, but we're not going to get into that. And you can't ask questions that are not needed for eligibility on the application form. Again, I talked about this in the last slide. Paper documentation is out. It's old school. We want to move to electronic sources. And the regulation talks about a new standard called reasonable compatibility, which is essentially that if the self-reported data, the self-reported income data, matches up with the electronic data, which could be from your tax form, if they're reasonably compatible, then we should assume that you are eligible for whichever program you're eligible for. Here's another one. I'm not going to read through it, happily, but you will have it, hopefully. So this was just an attempt to look at verification questions, which are so important and can lead to so many barriers on a whole host of issues, and talk about when a state can accept self-attestation for that, when a state must accept self-attestation, and how that's going to work, both in the context of Medicaid CHIP and the exchange. So there really is, since we're going to have so much data available electronically, there's less of a need to look to paper to verify things, and the self-attestation, in essence, will be backed up by the electronic data that's available. So let's move on from that. So renewal, here I think is a really important issue that we should spend some time on. I think Virginia, like many other states, you see some churning in your programs. A lot of times children and families who lose coverage because they're not able to complete the renewal process with the required paperwork, they end up coming back on the program anyway, and so they just have a gap in coverage, which isn't great for a lot of reasons. So the renewal process is actually critical, and when you think about reaching kids who are eligible but unenrolled, I think if we really focused on renewal, we could make a big dent in that, again, regardless of the Affordable Care Act. So renewal will move to every 12 months, and again, this is a way in which we're going to see alignment with our tax system and the premium tax credits. which obviously you file your taxes once a year. And automatic renewals will be required if the data is available. Of course, beneficiaries will be required to report changes if they have them in their income and they're significant, but you can't require a signature for that. So there's also an emphasis on using pre-populated renewal forms, which I know you all are moving in that direction. And again, providing this opportunity for folks to respond through a bunch of different avenues, not just online. So the role of the exchange, I think I've talked about this already, but the exchange is authorized to make Medicaid decisions. It doesn't work the other way, but the exchange is going to be playing an active role, and that's why it's going to be so important as you bring up your exchange to think about this overlap between the eligibility determination processes. And there, you know, I'm going to leave it to the Virginia experts to talk about how they envision the technology working. But again, I think a lot of states are thinking about using a pretty robust website to accomplish this, using electronic signatures, that kinds of things. So a lot of action in this area. It's a complicated area, and it's really, it's a heavy lift to get these systems up and running, frankly. But hopefully, given that there's some seed money out there, given that there's some models that states will be able to share, we can really make some progress here to simplify and make this a really user-friendly kind of process. So the coordination, I think we've talked about most of this as well already, that there will be the single eligibility system, that there will be consistent standards across the programs, and there will be these data exchanges facilitated by the technology between both state agencies, but also from the federal government to the state with this new data hub that we are expecting from the federal government. With respect to the 12-month renewal process, the expectation really will be that somebody will maintain their Medicaid coverage for the full 12 months if their projected income is going to remain below the limit for the calendar year. Okay, so the last piece I wanted to just talk about for a few minutes, and I think Jenny's going to elaborate on this as well, is that I think for kids advocates and thinking about kids and families, and I fear that this was not fully thought out as the legislation passed, just because there wasn't really time to get to everything, is there are a lot of complexities, and you all know this better than anyone, in families and the structure of their families. And we can look at the data on the next slide to see what some of these are, and I think, here we go. There are a huge, enormous number of children who are not living with at least one parent. So when you think about kind of the tax filer household, it's not as simple as mom or dad filing the taxes and their kids all in the same household. So many children are living with one parent. They may have another parent in another place that's part of a different tax filer household. There are quite a significant number of kids, 3.7 million, who are not living with a parent, maybe living with a grandparent or other relatives. And then we are going to see a lot of kids, Medicaid and CHIP eligible children, who will have parents in the exchange. So that's another complication, because the kids and the parent will be in a different program. So thinking about how the service delivery, you know, it's an interesting question. You know, we all think it's better to be in the same plan as your parents. And that's sort of like my gut reaction, although when I think about my kids, and they are insured in my plan, but they have entirely different doctors, obviously, from mine. But there clearly are issues there about kids being in one program and the parents being in another. And then there are certain groups, where matters are more complicated for other reasons as well. And when you look at the eligible but uninsured kids, you see, particularly amongst the Latino population, families with mixed immigration status, that we have large numbers of uninsured kids, disproportionately high. So the issues facing immigrant families or families that are what we call mixed status, that's where you have a child who's a citizen but the parent might not be. Again, there are a bunch of different complexities there in terms of eligibility and also in terms of some of the key cultural issues, concerns about confidentiality, concerns about data being shared with federal agencies, a lot of really critical issues. And you can see here from the numbers that this is a significant minority of kids. And we're going to have to think about that. And we actually have commissioned some work in that area. So if folks are interested, we'll be producing some more materials thinking through some of these issues and what they mean for state advocates. And here, again, I think I outlined a few of these. It's interesting when you, because it's not something I'm an expert on, but have some familiarity with it. But there are some ways in which there are some important differences in the exchanges that are being set up. The shop exchange, which is really a small business exchange, has different rules from the individual exchange. So all to say that this is an area I think we're all going to need some good technical assistance, and we are working on some materials there. As well as probably fundamentally the most important thing at the community level, as you all know, is that this group in particular needs trusted assisters, folks that are, they feel confident, will preserve the security of their information, and that they can rely on to help them get through the process. So with that tour, I will leave you with our information, and I look forward to the discussion later, and thanks so much for inviting me.